LEADER trial is a phase 2 clinical trial that is a ctDNA guided study. It's for patients with early hormone receptor positive breast cancer who've received at least 2 years of endocrine therapy. The trial has two components. The first is pre-screening to see if there's any evidence of MRD or molecular residual disease based on a ctDNA assay. And if a patient has MRD, then the patient is eligible for the clinical trial in which the patient would get endocrine therapy plus a CDK4/6 inhibitor ribociclib. The idea behind the trial and the challenge that it's trying to address is that we know in hormone receptor positive breast cancer, disease recurrence can occur late. It can occur in the 3rd year, 4th year, 5th year, even later than that. Late recurrence and tumor dormancy is a major problem in hormone receptor positive breast cancer. So this trial does ctDNA screening with the idea that you can identify when those dormant cells are trying to proliferate again, when you're seeing presence of molecular evidence of disease or presence of disease based on a ctDNA-based assay. Intervening at that time would likely impact the proliferating cells and would optimize the therapeutic window. So the trial does screening based on ctDNA, and if a patient has ctDNA positive disease, is eligible for receiving endocrine therapy plus a CDK4/6 inhibitor. MRD refers to minimal residual disease. It is a term that's used in the adjuvant setting. So if you look at the treatment of breast cancer, including hormone receptor positive breast cancer, patients receive surgery, and then after surgery receive radiation or some standard